Well, if you or someone you know is in need of hip replacement surgery, there's a new approach that means a faster recovery and a higher success rate. Dr. Brian Miller from Sonoran Hip Center is here, from Scottsdale actually, to tell us all about it. Welcome, Dr. Miller.
Thank you for having me.
I am so excited because it's always interesting to learn about new approaches, especially to surgeries that traditionally will take people down for a long time. So tell me, what is new about this type of procedure?
Well, a lot of the operation is the same. What makes this different is the approach that we're doing to the hip.
Okay.
And the newer approach, we don't cut any muscles. By not cutting any muscles, we're able to get people up and moving much quicker.
Okay. So this is a new, but you say it's new, but it has been around though for 5 years. I don't want people to think that, oh my gosh, you know, it's not tried and tested yet.
It's been around in smaller circles for probably close to 50 years and more popularized over the past 10 years in this country, and has become gaining a lot more popularity in the past few years, basically because of the results.
Now, what are we seeing here?
That's a hip replacement, and if you also look at the model that we have up on the set, that is what it actually gets implanted inside of you.
And this
over
right here?
And all those metal pieces in there you can see are put inside of your hip. You have a stem on this side and a cup on the other, and this ball is what replaces your socket.
Wow. That is amazing. And you don't have to, I don't, the technical part of it, how you don't detach muscles is amazing. But now we're looking at, this is actually a patient who had this procedure done. And is this something that you have to, wow, what is that?
So part of this new approach, and the reason why it's only become popular recently, is it requires a special table that puts your leg in special positions. And this is that special table. And it's really pretty incredible what it does. And this is what makes this approach easy for me to do and facilitates me being able to do this in such a manner.
That's amazing. So this is the table that you actually do the procedure and the operation on. That's in the operating room?
Yes.
Wow. That is really unbelievable. Are there certain types of people who qualify for this method?
If you're an experienced surgeon with this approach like me, almost anybody is a candidate for this approach. So anybody who's a candidate for a hip replacement in my practice is a candidate for an anterior approach.
Okay, so it doesn't matter at how bad your hip is?
No, not at all.
Oh, really? How many of these procedures have you performed?
Several hundred.
Wow. Okay, so when people come in versus before, we'll just call it the traditional way or the other way versus now this new approach, tell me about downtime and recovery, that process.
So my average, people stay in the hospital with me on average 1 to 2 days. The majority of my patients are actually able to walk out of the hospital, usually with a walker the day after surgery.
No way.
Yeah.
And before, it would be several days in the hospital.
It would be at least several
therapy.
days, average 3 to 5 days in the hospital before, and in past decades even longer.
And still though, is follow-up therapy, physical therapy and things like that required with this type of approach?
I recommend it strongly. I find people do better quicker and fine points of their gait or really get there.
And this is your team that you work with?
This is our team. Yes, all of us. What kind of sets us apart, I think, from some other people is that because this is a newer approach, all of us have been formally trained in this approach during our training, which with newer techniques, sometimes, the people need to do the training afterwards. But we all had excellent training by some of the masters.
Wow. This is remarkable, amazing.
It really is. To take someone who walks with pain in every step, and in the space of an hour to 2 hour operation, then make them pain-free for the next 20, 30 years of their life is still pretty remarkable to me on a day-to-day basis.
Wow. Wow. Thank you very much, Dr. Miller. And then on top of that, being able to watch them walk out of the hospital. Well, here is their contact information. It's the Sonoran Hip Center. They have 2 locations to choose from. You can call the number right here on your screen to find the one closest to you, 480-874-2040. The website is sonoranhipcenter.com.